You're listening to The Range, Gardner-Webb University streaming and on-demand programming. My name is Jeff. In the studio with me, Dr. Jeff Hartman from the Exercise Science program here at Gardner-Webb University. Welcome, Jeff.
Hey, how are you?
I'm doing great. We're going to talk about your knees and running and whether or not it's good to run, if it hurts the knees, all that good stuff.
Yeah. It's as we talked before the mics came on, running's bad for your knees. Everybody's heard that.
I've heard that.
All that pounding can't be good for your knees. And so there was a interesting study that looked at this phenomena, and rather than just subjective, how do your knees feel stuff, they did a lot of blood draws and synovial fluid from the knee and looked at different markers of inflammation and of joint health. And if you want the specifics, you can go to the study and read that. But I thought the findings were pretty interesting for two reasons. One, lo and behold, runners' knees are actually healthier. When you look at these markers of inflammation in the blood and the amount of synovial fluid in the joint, runners tend to have healthier knees than non-runners.
Interesting.
Which might have come as a surprise for some because we were constantly told, well, you're going to destroy your knees. But the second interesting thing, the way the study was designed, they had a small group. So mind you, this is a small group, 15. They were only able to collect really good data on 6 or 7 of the 15. So that's an asterisk. Keep that in mind.
Small sample size, yes.
But they had them run for 30 minutes, and they had them sit for 30 minutes on different occasions. So every runner did the same thing. And after running, they did the blood draws and the synovial fluid draws before and then after the running, or before and after the sitting for 30 minutes. So we already said, after the running for 30 minutes, their knees looked better. They looked healthier. Interestingly, those that when they sat for 30 minutes, so they had the blood draw, they just, in a wheelchair, they wheeled them into the lab and just had them sit there for 30 minutes. These runners had increased markers of inflammation in their blood from sitting for 30 minutes.
Yes. So
it's kind of the double whammy there. Maybe running isn't necessarily as bad for you as what you constantly hear from non-runners, probably. And 2, maybe sitting is worse for you.
Yeah, which is a major theme of this podcast. That
absolutely.
Sitting is a bad thing.
Yeah.
The new smoking.
Yeah, we're kind of turning it on its head a little bit, right? So run more and sit less.
Now, one thing that the study, it doesn't appear, looked at is, over a period of, say you've been running for 20 years, there could be some wear and tear over that period of time.
These were habituated runners. So these weren't just, hey, let's grab you off the street and have you run. These were individuals who had been running for a considerable amount of time. Interesting
stuff. Dr. Jeff Hartman from the Exercise Science program here at Gardner-Webb University. If you have comments or questions, email us at the station, info@wgwg.org.